Welcome everybody to the Medical PT. Today we're discussing the anatomy of the abdominal aorta. We will talk about some of the common branches and then do a quick video on abdominal aortic ultrasound, specifically short axis view of the aorta. So where we start below the diaphragm, just below the xiphoid. We are observing the proximal and mid abdominal aorta, which are everything above the renal arteries is the proximal aorta. Everything below the renal arteries is referred to as the distal abdominal aorta. The most common branches that we'll see are the celiac trunk, that's the first branch. We'll see the superior mesenteric artery, the SMA. We'll see the renal arteries potentially. And then we'll get all the way down to the umbilicus, where we should see the aorta bifurcate into the common iliacs. So how do we actually do the ultrasound? We aim the indicator towards the patient's right side. We can use the curvilinear probe or a phased array probe, also called a cardiac probe. What we're trying to look for on the image is at the bottom of our ultrasound image, we should see the vertebral body, and that should look like a curved semicircle. That's the anterior longitudinal ligament, and then the aorta should be just above that. So we're going to look at the proximal aorta and the celiac trunk first. And so in this video, you can see the vertebral body here, the anterior longitudinal ligament. There's the aorta there. And then we will play this again, and we'll see the celiac trunk coming off of the abdominal aorta and then branching into the hepatic and splenic arteries, which resembles that seagull sign that you'll see up here. Good. So next is we'll see the superior mesenteric artery that looks like a mantle clock. You can see that there. There's our abdominal aorta. There's our SMA. Running between the SMA and the abdominal aorta is the left renal vein. Above the SMA is the splenic vein. And then you can see on this side over here is the IVC. As we move down the abdomen, we'll see the mid aorta, which is just, here's our circle in the aorta just above the spine. There's our IVC. And then lastly, we'll see the abdominal aorta bifurcate into the common iliacs. So jumping back in, we'll have this video shot with the butterfly ultrasound probe. We can see here that we've got the vertebral body anteriorly. There's our aorta. Above that is the SMA. And what is interesting is that you can see briefly the left renal vein between the SMA and the abdominal aorta. If we back this up a little bit, we'll be able to see the renal is actually coming off here at that point. On this side is the IVC. Again, splenic vein over here on the top as well. So that's the classic SMA level. Now, the interesting thing about this is below this point, or below the kidneys, about 80 to 90% of abdominal aortic aneurysms occur. And so that's an important metric for us to be aware of as we're scanning our patients, to know that most of the aortic aneurysms occur below this level. Not to say that they can't occur above, but that's just the statistics on that. So an abdominal aortic aneurysm is defined as an aneurysm diameter greater than 3 centimeters. Usually we're pretty concerned above 3, but certainly as it gets to 5, 5.5, that's indications for surgical intervention. So as we're screening our patients, that's an important number to have in our mind. Follow me for more ultrasound content and more medical content at the Medical PT.